Good afternoon, everyone, and welcome to Previewing Preview, an introduction to the AAMC Professional Readiness Exam. My name is Dana Pinchoff, and I'm a test administration specialist with the Preview team. And I'm joined today by my colleagues, Rebecca Frazier and Michelle Sparacino, both directors on the Preview team. Within the next half hour, we'll revisit why the AAMC started work on a situational judgment test for medical school admissions. We'll talk about what our SJT, the preview exam, measures and its format. And then we'll focus on the 2022 administration and the important information you need to know as an applicant. The AAMC has always helped America's medical schools educate a physician workforce equipped to meet the health needs of our communities. Now we are working together to ensure the next generation of physicians is even more prepared for the challenges they will face. To provide even better care for patients, the next generation of doctors must understand far more than chemistry and human anatomy. They will need to provide compassionate care that nurtures their patient's mind and body, to collaborate effectively with multidisciplinary medical teams, and navigate emotional, cultural, and ethical challenges with resiliency. The AAMC designed the preview exam to look beyond academic metrics to assess core personal skills such as resilience, service orientation, ethics, and teamwork. When combined with other parts of the admissions process, preview scores provide medical school staff with a more complete view of an applicant and provide the opportunity to broaden the diversity of the applicant pool invited to interviews. The AAMC Preview program is a community-driven, expert-developed, and evidence-based program. Every decision we've made for the program, from the design of the test, its presentation and response format, to how we administer the exam, is driven by the needs of our community, is developed by our testing and assessment experts within the AAMC, our partnering contractors, and our technical advisory committee of nationally recognized testing experts. Based on research evidence we've accumulated on the preview exam, while we turn to the literature to inform our approach, we conduct research on our specific exam to inform our decisions and answer important questions from our medical schools. The AAMC Preview exam is designed to measure examinees' understanding of effective pre-professional behaviors across 8 of AAMC's core competencies for entering medical students. As a product of its design, the preview score is a proxy for these competencies. It cannot tell us exactly how a person will behave in a given context, but rather information about the extent to which they know whether behaviors are effective or ineffective in a given situation. It reflects someone's potential or capacity to learn and develop in these competency areas, which is a necessary precursor to engaging in effective behavior. Using the AAMC Preview exam, we are able to assess pre-professional competencies through a series of scenario sets. A scenario set includes a scenario and responses. Each scenario presents a situation, some kind of conflict or dilemma that medical students may encounter during medical school. The dilemma calls upon examinees' knowledge or understanding of one or more pre-professional competencies. The responses present the examinee with possible actions someone might take in response to the scenario. Examinees are instructed to read the scenario and each response. Then, for each response, they are asked to evaluate its level of effectiveness from very ineffective to very effective. The scoring process involves 3 main steps. As a part of the scoring key development, we have a group of medical school faculty and staff review each scenario and evaluate the effectiveness of the responses. The key for each response reflects the consensus effectiveness rating amongst the medical school faculty and staff. During scoring, the examinee's effectiveness rating for each response is compared to the consensus rating or key. Responses that match the key are awarded full credit. Responses that are close to the key are awarded partial credit. Examinees' total scores are reported on a score scale ranging from 1 to 9, which reflects their alignment with medical educators' ratings and the extent to which they understand what is effective and ineffective pre-professional behavior. Prior to launching the pilot administration in 2020, we conducted a series of research studies. We collaborated with over 150 medical school faculty and staff, representing over 75 US medical schools, to ensure the preview exam measures pre-professional competencies in a meaningful way and is scored to reflect the standards and expectations of medical schools for entering medical students. This research demonstrates that the preview exam consistently tests the identified pre-professional competencies and predicts how students will use these non-academic skills in their related coursework, as well as how faculty rate their performance. Also, before launching the pilot, we reflected on the value of an additional assessment to the medical school admission space and considered what medical schools value in a new assessment. We wanted to develop an assessment in collaboration with medical schools to ensure meaningful measurement of pre-professional competencies and alignment with medical schools' expectations for their future medical students. To ensure the integrity of the test with strong test security measures, we wanted to provide scores that are easy to use and are comparable within and across years. We wanted to provide a positive examinee experience, including providing scores to all examinees. And finally, to ensure that the test had strong psychometric properties, is reliable and valid, is fair, and predicts future performance. We believe that we've designed an evaluation of professionalism that lives these values, provided a more complete picture of applicants, and empowers schools to identify applicants who are prepared to learn about professionalism in medical school and meet the healthcare challenges of the future. This year, we will transition out of the pilot phase and into a limited operational release of the AAMC PREview exam. As we prepared for this year, we identified additional opportunities for improvement. Approximately 50% of eligible applicants completed the preview exam in 2021. We suspect this may be for several reasons. One, that applicants had the option to complete or not complete the exam because schools recommended rather than required it, or that the testing program remains new and not all examinees were aware of the test. This year, we are taking additional steps to increase outreach to advisors and examinees to continue building awareness of the preview exam. We are also continuing to improve our resources for examinees and remote proctors, as some examinees reported technical difficulties on exam day when configuring their computer or during the exam. While this is a small percentage of examinees, we want all examinees to have a positive experience. And finally, beginning this year, we will release preview score data to participating schools via the AMCAS data exchange service. So applicants who complete the exam will have their preview score delivered to schools they apply to alongside other application information. With some noted improvements, we will continue to use our proven administration model. The examinee experience will include 4 main steps. Beginning in April, you may begin registering and scheduling your preview exam date. The AAMC is continuing to provide free preparation materials, including a full-length practice exam to help level the playing field. When it's time for you to take the preview exam, you may choose your location and use your own technology. You are required to have a stable internet connection, computer, and web camera. Finally, both examinees and schools will receive preview scores and other score data to help you interpret scores and let you know how well you performed in comparison to others. This year, registration and scheduling has opened on April 5th. The testing year will run from June through September, with scores released to both examinees and participating schools approximately 30 days following each test date. When you visit aamc.org/preview, you will see a button to log into this portal using your AAMC credentials. The system will ask you to review and confirm your personal information before moving forward into the portal. Once on the products page, the 2022 Professional Readiness exam will be available, and clicking on it will prompt you to select your time zone, and your preferred exam date and time in one of the 5 available testing windows. One important thing to note about the scheduling system is that all appointments are displayed in the 24-hour clock or military time. There are other resources in this portal, which we will discuss shortly in the presentation, such as the platform tutorial and the link to test your equipment. Accommodations are available for the preview exam. Accommodations web pages contain information students need to understand the application process and how to take the preview exam with accommodations. Each section of this web page is geared toward a specific component of the accommodations request process. On this web page, you will find details of the standard testing conditions so that you can determine if you have a disability, impairment, or medical condition that requires an adjustment to those conditions. We recommend to familiarize yourself with the standard testing conditions and the entire request process before applying. Here is where you will find review cycles and deadlines, as well as information about documentation requirements and a list of items not requiring prior approval. The preview testing environment is different from the MCAT, but understanding the demands of the application process, the AAMC has made adjustments to ease the burden on students and expedite the process for those who already have accommodations approved for the MCAT exam. We are continuing to provide examinees with free preparation resources. These include an examinee preparation guide, as well as a practice exam booklet. The preparation guide provides preparation advice and strategies for completing the preview exam. Our practice exam booklet includes a full-length practice exam with scoring keys and rationales for all items. This is intended to help examinees become familiar with the format of the exam, the types of scenarios used to evaluate their understanding of pre-professional competencies, and the process for evaluating responses. In addition to those resources, there are other resources you can take advantage of to help you prepare to take the exam. The AAMC Preview Essentials for the testing year 2022 is the official policy and procedure guide for the AAMC Preview exam and is now available. On exam day, you will be required to agree that you have read and understood this document. The technical and environmental requirements for testing remotely are already available at aamc.org/preview. You can test your equipment at any time before you sit for the exam. After you register in the AAMC Preview portal, you will have the opportunity to take a platform tutorial, which allows you to learn and explore the features of the testing platform. To help manage test day expectations, we will also be providing a free video resource that walks through every step of test day, so you know exactly what you will experience. On exam day, you will progress through a few steps during your exam session. The length of an exam session is generally 90 to 120 minutes. This includes a maximum of 75 minutes of exam time plus additional time for administrative steps. The chart here represents a typical exam session. Total session time may vary due to required technology check for remote proctored online exams. You may shorten that time needed by ensuring before your exam check-in that your workspace is cleared of all prohibited materials, that your technology meets all the required specifications, and that your applications and other programs are closed. We recommend going to your testing location about 15 minutes before your scheduled appointment. This way, you can prepare your workspace, test the equipment again, and make sure you can log into the portal without any issues. Doing this will help ensure a smooth check-in with the proctor and prevent any delays in starting the exam. However, you should not expect to launch the exam and connect with that proctor until your exact scheduled time. We will continue to support you throughout your preview experience, from registration to preparation to score release. You will continue to have access to free preparation materials. You may test in a location of your choice with your own technology. You will receive the same score data that we provide to medical schools, so you know how well you performed and what the schools will consider in the evaluation of your application. Your score will be automatically reported to any AMCAS school you apply and will be reported each year moving forward. Finally, you will have the option to retake if you reapply the following year. As a part of our research and development, we have established a score scale and ensure that scores can be compared both within and across years. After careful consideration, starting this year, there'll be a $100 flat fee for applicants to take the preview exam, including unlimited score distribution. This fee structure offers the best value for applicants who submit multiple applications. The flat fee will be waived for applicants who apply and are approved to receive benefits through the AAMC Fee Assistance Program. This year, 18 schools will be participating in the preview program. Most will be recommending the preview exam, and a handful will be requiring the preview exam. Across these 18 schools, approximately 40,000 applicants will be asked to complete the preview exam. To find the list of schools, visit aamc.org/preview. To stay connected with the preview exam, consider attending our upcoming webinars, including a Q&A next month with participating schools and a preparation-focused webinar on June 7th. For updates on the timing of these webinars, visit the preview website in the coming week. We believe that we've designed an evaluation of professionalism that meets our shared goals and values for an assessment, that provides a more complete picture of applicants, and that empowers schools to identify applicants who are prepared to learn about professionalism in medical school and meet the healthcare challenges of the future. I'm now going to open it up to questions to myself or my colleagues about the preview exam. It looks like here we have a question about scoring and evaluating responses. I'm going to flag this question for my colleague, Becky. Rebecca, when looking at a response, how do you know whether something is effective or very effective?
Sure. So I would recommend for the preview exam, as Dana presented, the preview exam displays the scenario as well as a series of responses, and we ask you to use a rating scale to evaluate the effectiveness of each response. Well, on the slide that we presented here, we show just the names of each rating scale point, very ineffective to very effective, in our preparation resources, as well as within the exam instructions and within the exam interface. There are descriptions from very ineffective to very effective to help you better understand what each of those rating scale points mean. My recommendation as you begin to prepare for the preview exam is to take advantage of the preparation resources that Dana outlined, including the preparation guide as well as the practice exam booklet. The practice exam booklet includes a full-length practice exam. It includes a scoring key for all of the responses or items on that practice exam, as well as scoring key rationales. So using that practice exam, you can become more familiar with the types of scenarios and responses that we're using to evaluate the pre-professional competencies on the preview exam. You can also become more familiar with the rating scale and how our medical school educators who created the scoring key, how they're interpreting and applying that rating scale. So you can become more comfortable with how to use the rating scale by working through the practice exam scenarios and responses and reviewing the scoring key and rationale for those.
Thank you so much for that answer, Becky. Now we have a couple of administrative questions. First, a question for you, Michelle. So the question is about how the test will accommodate students with disabilities. Can you talk about some of the accommodations that are offered for this exam?
Sure. The most commonly requested accommodation is extra time on the exam. We typically will offer a time and a half, time and a quarter sometimes, as well as double time if needed. Other timing accommodations would include break time. There isn't a standard break time included in the exam because the exam is relatively short in comparison to other standardized exams. But if someone needs a break or needs stop the clock breaks, for example, those are other commonly requested and approved accommodations. There might be others, but those are by far the most common requested accommodations and approved accommodations. Dana, you might even think of some examples as well. We do have an accommodations process. You have to apply. There is an application online, and if you already have for example, an MCAT approval, if you've already gone through that process, then we have an expedited process. The application requirements are very similar. The documentation requirements, I mean, are very similar to the MCAT program. But if you've already gone through that process, as I said, we try to expedite your application. We don't expedite the application, but our process is faster. But we do offer most of the same accommodations as they do. There are some that are not even necessary because it is a completely fully online exam. So there are some accommodations that are just not relevant. We don't have to offer separate rooms. You don't have to apply for them because you are expected to provide your own room and your own, and that room should be accessible to you. You're providing your own equipment. So we're assuming that you're providing equipment that is accessible to you. But anything else like extra time, breaks, screen readers, things like that, or human readers if you need them, we will review your application for those, and if necessary, provide that for you.
Thank you so much, Michelle. That was very helpful. This next question, a confirmation. So does financial assistance program help to cover the cost? The answer is yes. Those who are approved for FAP will be able to register for the preview exam at zero cost. So we have a couple of questions about the exam content. So this would be for Becky. The first question is, are there only multiple choice or Likert type items on the exam? Are there any other types of questions that students will be expected to answer?
Sure. So the preview exam includes 30 scenario sets. So again, going back to that example scenario set that Dana shared on the screen earlier. So each scenario set includes that brief paragraph scenario, as well as a series of responses. And for all of the responses, we're asking you to rate each response from using the rating scale very ineffective to very effective. That is the only item type on the preview exam. There are no open-ended questions. You will see 30 scenario sets similar to the example shared here.
Perfect. And a follow-up, another question, could you highlight some of the differences between this exam and the Casper exam that some schools are asking applicants to take?
Sure, absolutely. And I'll go ahead and address one other question that came in as well. So there were several folks that asked whether the preview exam was replacing the Casper exam for this cycle. And the answer to that question is no. Medical schools have the option to include the preview exam as a part of their process or the Casper assessment as part of their process. And there is one school this year that is giving applicants the option to complete either the preview exam or Casper. So I want to make that clear here. Preview is not replacing Casper. They are each an option for medical schools to use to get to more fully evaluate their applicants and get a more complete picture of their applicants. The difference in terms of the exams themselves, there are a few key differences between the preview exam and the Casper. Each of these exams is measuring some similar things and some different things. The preview exam is designed to measure pre-professional competencies, or more specifically, your understanding of effective and ineffective behavior across 8 pre-professional competencies that are a part of AAMC's core competencies for entering medical students. The Casper exam measures personal characteristics, some of which are similar to those pre-professional competencies that the preview exam measures, some of which are a little bit different. The design of these two exams is also different. So on the preview exam, again, you are seeing a series of scenario sets like the sample that is being shared on this screen, where it's text-based scenarios, so brief few sentence descriptions of a situation, and then a series of possible responses, and you're being asked to use that rating scale to evaluate the effectiveness of each response. On the Casper exam, they use a mix of text-based scenarios as well as video-based scenarios. And then they pose open-ended questions where you are constructing your response. So you're typing your response to to questions that they ask after presenting you the scenario. The way that these exams are scored, for the preview exam, we have medical educators complete ratings for the responses to the scenario sets, or the items, if you will, much like you as an examinee would. So they read the scenarios, they read the responses, and they provide their ratings. And then we look across that group of diverse medical educators' ratings to see where they are in agreement and where they are in disagreement. If they are in sufficient agreement, then that becomes the scoring key for the response, and that response is eligible to be included on an exam. With the CASPER exam, they are reading the written responses and evaluating, having evaluators evaluate those responses.
Thank you so much, Becky. That was very helpful. There have been a couple of questions about the schools that are participating for this year. So I'm going to go back to the school slides so everyone can take a look at these. The information about which schools are recommending versus requiring the exam is available on the preview web pages. And there is a question also about when you'll receive your score. So depending on your test date, you'll receive your score approximately 30 days after you complete your exam, and the medical school will receive that score on the same day. There is also a question about how scores get to medical schools. So I will send this over to Michelle. So is there anything additional that students have to do to get their score to a recommended school or a required school?
For all but one of these schools, there is nothing additional you would need to do. All of the schools but one, and I'll point that one out first, which is Des Moines University School of Medicine and Health Sciences. That's an osteopathic medical school. For that school, you would have to select that school on test day. So at the end of your exam, if you choose to score your exam versus void it, you would have to choose, you'll have an opportunity to choose Des Moines on that day. And if you do, then we will send your score to Des Moines on the score release day. Otherwise, when you apply to AMCAS, if you choose one or more of these schools within the AMCAS application, your score will be automatically available to those schools when you select the school. So for all applicants applying to AMCAS, your score will be automatically uploaded into AMCAS. And when you select any of these schools participating in AMCAS, those schools will have access to your preview score.
Thank you, Michelle. This I'm seeing a couple questions about how schools will view this score. So first, I would encourage anyone wondering about this to attend the webinar that we will host with a couple of representatives from participating schools, and that'll be next month. The date and time will be up on the preview site in the next week. But I will ask Becky to weigh in here. So can you talk a little bit about how schools are using this score and as a part of their admissions process?
Sure. So I think what's important to know is that schools are able to use preview scores in different ways, and it is their decision how they ultimately incorporate and consider preview scores alongside other application information in their admissions process. The AAMC provides guidance around best practices, really focusing schools on how to incorporate preview scores to ensure holistic review and to really get that more complete picture of an applicant as they make their decisions along their admissions process. But schools may use preview scores at different stages of the admissions cycle or admissions process, and they may use them in different ways. So if you are, I would recommend that you visit the websites for these different participating schools and reach out to them if you have questions about how the preview scores will be used in their process. You can also, as Dana mentioned, we will be hosting a webinar in May that engages a few of the participating schools to share how they'll be, why they're incorporating the preview exam into their process, and how they'll be including scores in their process. Thank you so much, Becky. We are running very low on time, but I want to hit a couple of
questions, hopefully with this slide here. We're getting a couple of questions about when you can test. So the first test dates are going to be in June. Registration is open now for all of these testing windows. So you can go online now and select your preferred date and time. There are also a couple of questions to clarify where you take the preview exam, and this is a remote online exam in the location of your choice. There'll be more information available in our upcoming webinars, one in May with participating schools and a preparation webinar in June, on June 7th. Thank you all for your questions today and for joining us. And if you need to reach us, please email askpreview@aamc.org.